Pastor Jummy Opedare, a devout woman of God, wife, mother, and entrepreneur. A God-fearing woman who has devoted her time to ensuring that God's message is used to empower everyone, but most especially women. With a strong belief in the importance of women empowering women and educating each other through our life experiences, she is the founder of Women's Forum, Let's Be Real, a forum for women to work through issues and set and accomplish goals together. Held every second Friday of every month at 6 Elton Road, Lee Green, London. Keep up with Let's Be Real here on PRZ FM every Tuesday, 8 p.m. to 9 p.m.
Hello everyone, welcome to another episode of Let's Be Real on PRZ Radio 109.2 FM. My name is Jummy Opedare. God bless you. Thank you for tuning in. I want to say thank you to all our listeners all over the world. Every Tuesday PM you tune in, you send in your comments, your questions, and your requests. Thank you so much. We really appreciate you from the team at Let's Be Real. Don't forget that you can email us if you have any question, any further question, any new question, any contribution, any topic that you want us to bring on here. Don't forget you can email it to us at letsbereal@przfm.com. letsbereal@przfm.com. It's always a wonderful time on this show, and you never know what we will bring up. Today we are having our health hour with Dr. Dami Oyekan. Thank you for coming in, Dr. Dami.
Thank you for having me.
Okay, so there's so many things that we have talked about on Let's Be Real in terms of our health, and it's been working for some people. Some people have given their feedback, they have sent their things, even regarding, we talked about menopause sometimes was so popular, people are going through things, and the response was very good. And today we are talking about this common word, headache. Yes. Is coming. Maybe hardly will you not hear about headache in a week. And I know you doctor, you will confirm that almost every time people come with headache, I don't know the level of that pain, but you will explain to us what headache is and what is we shouldn't classify as headache, or when we should take it serious and when not take it serious. But the common word that people will express when they are in pain is headache. And recently I've had so many people had it bad. They've had it bad. So we thought it's something that we should talk to people about, that they should be knowledgeable and know when it is a serious matter and when they can deal with it at home, and not to ignore the signs. Dr. Dami, please, can you explain to our people what headache is?
So again, good evening everybody. Thank you for tuning in. So just as you said, this term headache is a very, very common one. I don't think you can find a single person who hasn't experienced a headache. You know, young or old, rich or poor, working, not working, everybody usually experiences headache at some point in their life. And from a medical perspective, particularly in general practice, which is where I work, I can't really go through a day or two without seeing a patient coming and complaining about a headache. So when we say headache, it describes exactly what it is. It talks about a discomfort or a pain that is in the head region. But that can also include things like behind the eye, around the back of the head. Sometimes this pain goes into the neck or the shoulders, but it's commonly referred to as a pain headache in the head or eye, behind the ear, etc. And that's what we describe as a headache. Okay, now personally, I've had different type of headaches before. That maybe it's just one side of my head is hurting, or I'm having this, whatever. It might not be serious. I don't know. Are there different types of headache? Can we identify them, that this headache is this type and that headache is that type? So first of all, even seasoned medical professionals find it can find it, so a bit more difficult to diagnose exactly what type of headache somebody has in one go. Usually you have to take quite a lot of information, or sometimes you see people over a period of time to really get what the headache is that they're suffering, because a lot of things about headaches overlap. But headaches, first of all, there are a lot of different types. So, you know, the field of medicine, they like to give a name to everything. So there are so many different types of headaches. The specialist that deals with, you know, with particular things of the nerves, neurologists, they're quite good at dealing with headaches as well. But even they cover a lot of different types. But in general, we divide headaches into two groups. We call them either primary headache or a secondary type of headache. And basically the difference between the two is related to whether or not a headache has a specific cause to it. So a secondary headache is a headache that is caused by a condition or a disease of some sort. So there's some underlying pathology that we know. So by pathology, I mean a disease process that is causing the headache. And this can range from something simple to something quite scary. But that secondary type of headache is less common, far less common than the primary type of headache, which is the type of headache we see a lot in general practice. And basically that type of headache usually covers about 80 to 90% of the headaches you see as a GP would see in general practice. And it's a headache that's just related to some sort of change or abnormality related to the body's normal process or pain pathways or chemicals in the head. But the primary headaches, they're literally about 90% of them, they can be, you know, very, very severe and debilitating. So by that, I mean, they can affect somebody's life, quality of life, the way, you know, if they're able to work, if they're able to interact with their family, if they're able to do the things they normally do. But they don't tend to be classified as the life-threatening type of headaches. Whereas in the secondary type of headaches, you can have very simple things from, like, you know, simple infection to causing a headache, ranging to something as sinister as, you know, something building pressure inside the head causing a headache. So that's how we classify the two types. But it really is something that you might sometimes need a medical input to differentiate between the two types if you have persistent headaches. And it can be even difficult from a medical perspective to diagnosed definitively at, you know, one point, oh, you definitely have this. Sometimes it's clear and sometimes it's not. So it's just to give people a taste of that.
Well, which ones are the common headaches? I've heard of migraine before. Well, which ones are the most common ones? So
under the classification, again, like I said, the primary headaches tend to be the commonest type of headaches people have, which tend to be not life-threatening but very severe. And it's under that bracket that you find some of the common types of headaches that people might have heard of. So one type is, just as you said, Auntie, is migraine. Migrainous types of headache, which we'll talk about. Another type is tension type of headache. So tension headache. There are headaches called cluster headaches as well. That's quite a common type of headache in there. So these headaches are all under the primary headache. So should I break down? Yeah,
please, because I don't so that people can understand. This is less belief. So that, you know, some people we hear cluster, they don't understand what that means. Or tension, does that mean when I'm in tension that's the headache comes, or what?
No. So let's talk about tension headache work, because that's, I think, probably by far the most common one that I personally see as well. So tension headache is a type of headache that most people usually complain about on a, you know, day-to-day basis. It's that headache that usually occurs either at the front of the head or around the head. Feels like a pressure or a tight band or a throbbing sensation. Sometimes you feel it on one side and then it moves to the other side. It's not necessarily associated with just one side of the head, like some of the other headaches are. It tends to be across the head, either at the front or around the head or around the back. It can be quite a dull ache. It usually doesn't start off suddenly. It starts off gradually. It might, you know, it might just start off as a mild headache, and then it sort of becomes a bit more troublesome as time goes on. People tend to suffer it more towards the end of the day, but they can also wake up with it in the morning. It's not as commonly with a tension headache. You don't tend to normally get, you know, a lot of nausea or vomiting or sharp stabbing pain. You don't commonly get any sort of limb weakness, so your legs and arms and things like that generally are not weak or anything with it. And that headache is often the simple type of headache that we all get when we are perhaps really stressed, or when we're, you know, very dehydrated, or, you know, when we're very angry. It's usually related to the fact that you've got muscles that cover the front, that cover the skull at various points, and sometimes when they're under a lot of tension, they cause this tension type headache. But again, the tension can come from lots of things, from, like I said, dehydration, stress, anxiety, sometimes people being very low in mood or having mood fluctuations. So but it's the most commonest types. That's tension headache.
Okay.
The migraine headache now, a lot of people have heard of migraine.
Oh yeah, it's so common.
Yeah, it's very, very common. It tends to be people who...
Or maybe we just classify every headache as migraine.
I know, that's
can
the
also
thing.
be.
Exactly, that's it. A lot of people just label a headache, say, oh, I have a migraine. And usually it might even be tension. But a migraine headache, that's the one that most people commonly tend to find affects one side of the head. And that migrainous headaches, again, can be very, very, I use the word debilitating. So the type of headaches that might stop you from going into work. They're more associated with things like nausea and vomiting, or feeling really dizzy, feeling disorientated. Some people get what we call an aura before a migraine. And what I mean by that is like the body giving you a warning sign that you're about to get a migraine. So sometimes people can get changes in their vision, and they know that as soon as this happens, within a few minutes or so, I'm going to get this migraine headache. With migraines, some people can also get changes that affect their the rest of their body. That can affect their limbs. For example, on one side of the body, they can get tingling or weak, or, you know, sometimes a weakness in their limbs, and that can be quite scary, because you could be thinking, am I having a, you know, if this is the first time, am I having a stroke or anything like that? And then you get a health opinion and you recognize that it's a migraine, and soon you come to know that this is what happened when what happens when you have a migraine. So that one happens. You tend to find as well that some people can get these type of migraine headaches associated with women in particular, associated with changes in their hormones. So the types of headaches that some women get, where literally before they start their period, they know they're going to get this headache. In fact, this headache tells them, okay, my period is coming in a few days time, and it tends to be a migrainous type of headache, not usually with an aura, but just a headache that is very, very severe or very debilitating, and it's a result of the drop in hormones because they're about to start the period. So that gives you sort of an overview of some of the migrainous type headaches. And the other one I mentioned, cluster. So that one people don't commonly know about that one as like that term. But a cluster headache, it describes basically a series of headaches that are focused around an eye. Okay, it usually affects, again, one side of the head, but usually the pain is around the eye, either behind the eye or around the eye. It's very, very severe. I mean, people who I've seen that suffer cluster headaches describe it as one of the most severe pains.
Should we not say that there is a problem in the eye that caused the headache in that situation?
It's one of the things that we will rule out. So in medicine, it's not, you know, people I think sometimes assume that it's straightforward. If I tell you this and this, it's definitely this. Yes, sometimes it can be, but a lot of symptoms overlap in medicine. So it would not be unusual for somebody to have that and be like, oh, I need to go to the optician and check the eye. And then the optician will rule out there's nothing going on here. You go and see they'll tell you to go and see your doctor, and your doctor will say, this is what we call a cluster headache. But the key thing is that these types of headaches, they usually cause some kind of either redness in the eye, or you can find your eyelid swelling, or you find your eyes constantly watering with it when you get this headache. And this pain happens in like what we call a bout. So you can get the sharp pain. It can last for either a few minutes to a few hours. It stops, then it comes again. Within a day, you can have a few episodes of the same type of pain. This can happen for over days or weeks, and then all of a sudden stops. You don't get anything for months at a time, and then at another time point, the whole thing starts again. So that's why it's cluster headache, because it happens in clusters. But you would rule out other key things. So for example, if somebody came to me with that, I would want to make sure there isn't something severe happening in the eye, like build-up of pressure in the eye, something called acute glaucoma. So which we would have to make sure that that's not happening there. And then once those things are ruled out, you can say, okay, this is cluster headache. But you can see now why you might need a medical input when that happens, and not just to sit at home with it, because it's quite severe.
Wonderful. So we, in the primary type of headache, now we've talked about three most common ones.
3 common types.
And the second one, are they different types as well?
The secondary type.
Yeah.
Yes, there's different types. So secondary, going back to the definition, is a headache caused by something. So if you think of it in brackets, it can be caused by something as simple, for example, as infection. So if you have an infection somewhere in the head region, it can cause a headache. So a common type of headache that is secondary is sinusitis.
Okay.
So the sinus talks about spaces inside, that we all have these small little pockets of space inside areas of our skull that sometimes get really inflamed. So lots of blood cells and things rush there, and they can get infected. So you can get bugs and bacteria going there, and they cause a pressure in the head, and that can lead to a headache. Wow. So that's a type of secondary headache, sinusitis. So it can be as simple as that. And you can range from something as simple as sinus infection to a headache caused by infection, caused like something called meningitis. So that's where the membrane, so the thin films of tissue that cover the brain, gets infected, and you can get a severe headache with that. And that is life-threatening. So you can see how sinusitis, we can treat that simply, it's not life-threatening, but meningitis is life-threatening, and that is the cause of headache. So there's a spectrum. Other types of secondary headaches that you can get, you can get headaches related to underlying disease processes such as high blood pressure. So if people have really severe high blood pressure, so we're talking in the far end of the spectrum, that the blood pressure is so high that it causes a symptom of headache. So we're talking probably 190 plus, so the top number, systolic number, being over like 180, 190. Some people get really severe headaches with that. The other type of secondary headache that you think about is if there's a buildup of fluid in the head. So it's something called hydrocephalus. So again, the brain normally has a bit of fluid around it, that's normal, but if the excess fluid builds up there, that can cause a headache. And of course we talk about some of the more serious causes, which is if something is occupying space inside the head. So imagine the skull is a box, the brain is in the box, there's not much room to maneuver in there. If something starts to grow in the brain, God forbid, but if something grows in the brain, it takes up space that really there's not much space left. So we call it a space occupying lesion. So for things like tumors, etc., they will cause they can cause headaches as well. And also an important thing that can cause secondary types of headaches, again very serious, is if you get a bleed in the brain. There is a type of headache called or a type of headache that you get, what we call a thunderclap headache. So all of a sudden, out of nowhere, the most severe sharp pain in the head, that is, we call it thunderclap because the pain it will be really, really, really severe, and it's not getting any better, and it came out of the blue all of a sudden. That's very dangerous. That is very dangerous. Whenever somebody gets a headache like that, they should always get it checked out.
How long can they wait before they get help?
With a severe thunderclap headache, immediately, you should always get it checked out straight away. You shouldn't wait, because sometimes, it's not always the case, but sometimes it can be a sign of a sudden bleed in the brain, which is very dangerous and needs to be treated. And
people have survived it.
People have survived it, but as with anything in health, time is tissue. When you say time is money, time is tissue. So we're talking about the tissues in the body. So whenever something severe happens and you're not sure, I always say get it checked out. There's no harm in somebody reassuring you that it's normal. It's better than waiting and then finding out that it isn't.
Wow, thank you, Dr. Dami. This is Let's Believe. We are talking about different types of headaches and how you can identify which one you need urgent attention and which one you don't have to worry too much about, because it has up like the thunderclap headache. As you mentioned it, my body shook. Wow. So in such a situation, it's not that I have a headache, let me just go and sleep. I have a headache, let me take 2 paracetamol and just wait and see what will happen. But as soon as the pain is severe and is continuous, you need to find your way to your doctor immediately. And even the other is the other one, the migraine, tension and cluster, are they dangerous?
So they don't result in life-threatening It doesn't threaten your life, but it's still serious in my eyes because it's serious enough for people to need help that they can't do their day-to-day activities. So migraine and headaches, having a migraine doesn't mean that we need to rush you to a hospital to to do some sort of emergency procedure, but if you have a migraine to the point where you can't take care of your kids or you can't go to work, etc., you still need it treated because you need help. But they are far less dangerous than what we're talking about with the thunderclap headache and meningitis and things like that.
Because I know that anytime I have a headache, nothing matters anymore to me. Nothing is. I can't even
That's
think.
a very human reaction. But a reassuring message I want to say here is these life-threatening types of headaches, they are definitely in the smaller percentage of the types of headaches that we see. So although, like I said, whenever you're unsure, always get your headache checked out. But the vast majority, usually 80 to 90% of headaches that a doctor will see in general practice are headaches that we need to manage, but they're not going to cause somebody's life to be prematurely terminated.
Wow. Thank you, Father. Thank you, Dr. Dami, for showing this light. And I pray that any form of headache, God will cure whoever is facing it right now in the name of Jesus.
Amen.
Okay, can you enlighten us about the warning signs that this is a serious matter, or this is not something that serious, I can deal with it?
Okay. So if when you're going to see a doctor, any reasonable doctor is going to ask you a few questions first of all. So be a bit wary if you go to someone and say, I have a headache, and they're like, oh, just take some ibuprofen. They haven't asked you anything about the headache. So doctors will sometimes, you might feel that we're asking you too many questions.
History of your life. History. Does your grandfather have?
Yeah, sometimes not all questions are relevant, but there are certain questions doctors will ask you about your headache, and that's to tease out information as to whether this is a headache we need to worry about getting a scan done, or whether this is a headache we need to manage in a different pathway. As like I said, most headaches don't need that urgent pathway. But the kind of things that can be worrying is I didn't mention before, but headaches, obviously everybody can get headaches, but they tend to be quite common from the teenage years to age 50 or so. After that, obviously people can still get headaches, but a new type of headache, so if you're 50 or above and you start experiencing new types of headaches that you've never had before that in your life, they're very different to headaches you've had since you were younger, etc., and they're very persistent, or they're getting worse, that can be a bit of a warning sign to a doctor, because I'm wondering, why is your body developing this new headache now that you haven't had since you were your teenager, since in your 20s or etc., especially if it's getting more and more severe. So new onset headaches over the age of 50, a doctor will think about it in the context of, is this something to worry about? Another thing is certain types of headaches, people will have severe headaches ongoing, and they find that they do things that increase pressure in their bodies, and this makes the headache worse. So by that I mean they might have ongoing headache, and when they sneeze, the headache all of a sudden becomes the worst thing. Or they have the same constant headache, and then they cough, and oh my gosh, the headaches becomes like even just it's gone from 10 out of 10 to 100 out of 10 type of thing. Or they might be on the toilet and they strain. So you can imagine all these positions increase pressure inside of you, and they strain, and all of a sudden this headache becomes it's like 100. It's gone to 100%. That type of thing, again, if you explain that to a doctor, they'd want to get it checked out on a more serious level, because that can be a sign sometimes that there's something occupying space inside the brain. So those things. Anybody who gets changes with the nerves that are long term. So if you remember before, I mentioned that some people get migraines, and with migraines they might get weakness or nerve changes in their arms and legs, but the key thing is it disappears, it goes. And at some point they'll be checked out to make sure it's not a risk factor of a mini stroke or anything, and they just know this happens with their migraines. But somebody who gets a headache that's getting gradually worse and worse, then all of a sudden they can't use their arms and legs, and this is not getting any better, or they find that there's they can't do certain movements with one side of their body, or one arm or a leg, etc. That can be a sign of nerve involvement from the brain. So again, that would be quite a serious red flag. Wow. So those are the type of things.
So okay, thank you so much for enlightening us on that. So I believe that all our listeners are listening. Whatever the signs, what has not happened to you before is happening now, please seek help. or if what has happened to you before is getting more serious, or some other things are affecting it, then we need to seek for help. So those are the warning signs that this is a serious headache. Well, how can we minimize having headache?
So, complicated question, just because, like I said, a headache covers a whole plethora of different types, and different headaches have different contributing factors. But if we look at what in general contributes to headache under a general umbrella, so people who tend to have headaches or have them more frequently, this could either be associated with lifestyle things. I always have to plug it here: smoking and drinking excess alcohol, or sometimes there's an association with like somebody being overweight with having increasing frequency of headaches, or sometimes certain food types that people consume can affect their headache. So if you identify these type of risk factors, those are the things that you can address. You can I always say you can really try to stop smoking. Advocate, I have to do my doctor thing and say, please try and consider cutting down and stopping smoking. Exercising is a very, very good thing. It improves it. Managing stress levels. I think we've talked about it either on the show or in the Let's Be Real forum. Stress is just something that affects people on so many platforms, and you'll be surprised that managing stress really can affect particularly things like tension type headaches. Stress is one of the biggest contributors to that, so that's an important type of thing to do as well.
And to manage your emotions.
Yeah, exactly. Learn to manage it. Also, other things that can be cause of headache, but it's not quite as clear cut, is your mood. So if people are having problems with mood, depression, anxiety, etc., they affect hormone balances that can again cause headaches. So addressing the underlying problem, if there are problems with things like depression, anxiety, can help manage headaches as well. In addition to just your day-to-day life things like exercise and good diet.
Wow, thank you so much.
And sleep, I should remember.
And
Sleep. Good sleep hygiene is very important for common types of like headaches, like tension headache.
I was going to ask that question, that if you have a headache, you've taken paracetamol, do you not need to go and sleep? Just take a sleep.
Sometimes
or take sleeping tablets and just sleep.
Sometimes sleep does a lot more for you than medications do. By extension, I should mention there's a type of headache that again, you'll need a doctor to kind of help you with the diagnosis. Don't ever stop your medication suddenly without speaking to a doctor. But there's a type of headache called medication overuse headache. So a lot of us, we might get headache. We tried the paracetamol, we tried the ibuprofen. We're now taking codeine and we're taking it every day, so you've now got triple medication. Some people will now throw in tramadol on top of it because they're really suffering, and they'll be taking the headache they'll be taking the pain medications consistently, day in, day out, and actually the original type of headache subsides and you get what we call medication overuse headache, that your body has developed headache in response to you taking so many medications for this headache consistently.
So what does that cause to happen?
So your headache, the cause of your headache now becomes the tablets that you're taking.
Okay.
So particularly this is more associated with things like codeine or tramadol. So that's the stronger opioid type medication. And you find that this type of headache happens in people who've been taking it consistently for a long time, and the treatment for that is to stop the medication, so which can be quite difficult because people don't want to stop the medication because they'll get a rebound where the headache will be worse for a short period of time, but then they realize their body gets better because they're not dependent on that medication
just take
anymore.
water, isn't it?
Yeah. So but for that diagnosis, always speak to your doctor about it. They'll advise you how to do it in a safe way to support you, but using too much of those medications can make things quite bad.
Is it possible for headache to go without taking any medication?
Yeah. It's not, it depends on the cause of the headache and the type, but if I go back to the common tension type headaches, sometimes just being well hydrated, good sleep hygiene, or doing a bit of exercise, people feel better with that. And sometimes you do need medication on top. There's no harm if you do, but medication, headaches can go without medication too.
I also, maybe I read something or someone told me that if you have headache, you take caffeine. or coffee or
Coffee,
something.
yeah. So I find it interesting.
Or Coke.
Yeah. So the idea behind that with caffeine basically is that before people get headaches, or when they get headaches, the blood vessels in the body become bigger. So we say dilated. So the blood vessels become bigger. And what caffeine does, it works to close and constrict the blood vessels a little bit, so they're not as big. And so the theory is that helps if you're taking caffeine alongside some pain medication like paracetamol, etc. That some people actually find it helps with headaches, or they drink coffee and they find that their headache or their migraine gets a bit better. I'm actually on the shoe on the other foot, which that my own personal experience is that if I take coffee when I have a headache, or I take something caffeinated, my headache gets worse. So my own thing is I personally don't like it, but that's the rationale behind taking caffeine. The other thing is, though, if somebody is very caffeine dependent, I know there are a lot of people out there who are quite coffee addicts, etc., and then they don't have caffeine for a long time, the withdrawal from caffeine can be the cause of their headache, because their body is so dependent on the caffeine that when you take away the caffeine, they just get the worst type of headaches because the blood vessels really open up. So it can be either or.
Is it not also conflicting with people that have high blood pressure? You're taking caffeine to compress the from the knowledge of what you have told us in time past. That's what I'm
absolutely. So even prescription wise, I don't tend to prescribe or advocate for caffeine, but some people buy it over the counter alongside paracetamol because they find it works. But that's why you should always know what your blood pressure is and know if you are predisposed to having high blood pressure. If you are, then you want to avoid taking the caffeine because it will likely increase your blood pressure.
I think it's a good idea for everyone to check their blood pressure.
It's one of the most simplest things that you can do. I mean, nowadays you don't even need necessarily a medical professional. You can buy a blood pressure machine and check it, and then if you need someone to advise you on interpreting it, then you can get some medical advice. But it's always good to know your blood pressure. We've talked about it before. Blood pressure is often a silent thing until it's not. That you don't know you have high blood pressure until it becomes so high that it causes either a problem with your heart or your blood vessels, or causes something like headache, etc. So yeah.
What about blood sugar? Does it cause headache when you're...
It's important to have regular balanced meals. So I feel that when you have irregular meal times, etc., or you don't have regular stable balanced meals, again, that can increase stress on your body and that can contribute towards headache. But I wouldn't say directly in itself a low blood sugar causes a headache or anything like that, but it can contribute, like irregular meal times, etc.
Wow. Thank you so much. Now, what other ways can we treat headache?
So treating headache, now depends on the type of headache it is. There will be sometimes medications that can help, and sometimes it's other lifestyle factors. So people do use non-medical things like acupuncture and massages and just try more natural methods to kind of decrease the headache. But commonly when you're going to see a doctor, most people expect medication. The simple things that you can do before you even go to see a doctor when you have a headache is, number one, particularly if you have the persistent headache that's at the front of your head, or associated with any funniness with your vision, get your eyes checked. People sometimes don't realize that their headache is because they're straining and their eyes are straining, and they need to get their eyes checked so that they get some assistance with vision, and that will reduce the headache. If you see a doctor, they'll always ask, have you had an eye check recently, if you have one of those persistent headaches, because no matter what we do, if you're straining your eyes, we're not going to solve the headache. But simple medications like the paracetamol and ibuprofen, if you're allowed to take it, you'll know if you're not allowed to take ibuprofen, but that is the first simple measure. Everybody can buy that over the counter. Some people find doing warm, deep compressions, etc.
Which one is better, cold or warm?
The rationale would say warm compressions help because they open the blood vessel up a little bit more.
Warm, but like wrap a warm towel around your head.
Like particularly if you have the tension one in your shoulder, if the headache is in the back of the head going down into the neck and the shoulders, these warm towels, etc., they open up the blood vessels, so they just cause things to get better. So those warm compressions can sometimes help. And then if that fails, then we go to medication. Depending on the type of headache you have, there are a whole lot of different medications. So it doesn't even make sense for me to say take this or take that, because it depends on the type of headache that you have. But for example, a migraine, for people who have migraines, there's special medication that you can take to specifically for migraines. Sometimes you spray it up your nose, sometimes you just put it on your tongue, and that can help with migraines, and that's different from the ibuprofen and the paracetamol. It would have
gotten to the level that you are diagnosed with.
That you need it. The other thing to mention is that with some types of headaches, like the cluster headaches, or sometimes even with migraine headaches, if you get it so often that it's such a problem, a doctor might recommend you taking a long-term type of tablet to try and reduce how often this headache happens. So you might end up taking a tablet every day. That means that, you know, hopefully when you get the headache, it's not as severe, and that you won't get the headache as often as you've been getting it before. So that's what the doctor means when they say prophylactic tablet. So it doesn't cure it, but it reduces how often the headache happens and how severe it is when it does happen.
Thank you so much. Dr. Dami Oyekan has been talking to us about what types of headache, what we can do, how we can treat it, how we can address it. But the most important thing is that we need to check our lifestyle. That's the thing that we can do from our end. The medication the doctor can recommend.
Exactly.
Paracetamol is so simple to get, but when something more serious, we can't do anything from our hand. We just have to go and see the doctor. But whatever changes we can make. I read it from a book that if you have a headache, go for a walk when it's drizzling, not really raining. It will calm you down.
I don't know about the research for that, but if a walk calms you down, that reduces your stress. That's likely to reduce your headache.
Just go and just enjoy the nature. The nature, go in and walk in the park.
That's God's natural paracetamol for your headache. Go enjoy the view.
And I've tried it. It works. It works. I went walking with my husband. He was holding my hand and we were talking. Before we came back home, I've forgotten about the headache. So
that's a relaxation technique. So that goes to the addressing stress element of your headache. But there's one thing I wanted to mention as well, with regards to headache, because it's such a broad topic. Obviously, in this day and age, everybody wants to keep themselves informed. We have access to so much information, and it's our right to read up about things. But when we're researching, especially Dr. Google and
Dr. WhatsApp,
Dr. Google, etc., please take things with a pinch of salt, and just use, rationale and reasoning with it. So coming to Google, when you type in symptoms with Google, it's the very nature of Google for it to give you the worst case scenario. The Google has to present the worst case scenario because that's what Google does. And it's very reasonable to say, okay, these are the symptoms I've had. I say this to your doctor, these are the symptoms I've had, I've researched it, I'm worried about this, and then the doctor can specifically explain to you why they're not worried about it, or make sure that they address that concern. But if you automatically say, okay, my eyes are watering, I've got a headache, I type it in, and then Google tells me I have a tumor behind my eye, it will just raise your anxiety and cause unnecessary panic. So you have to take things with a pinch of salt. And the same thing with, there's a lot of WhatsApp doctoring goes on, take the lemon with the thyme and something like, okay.
I got one today.
The thing is, I mean, obviously, I'm a bit more critical, because with medicine, you practice what we call evidence-based research. So research has been done to show this is the evidence that this helps with this. That doesn't mean medicine knows everything. There are things in nature and natural remedies, etc., that perhaps, medicine hasn't really got the grips, got the hang of yet. But, so much information comes on WhatsApp and things. If it doesn't make sense, or if it has potential to cause you any harm or interact with the medications, or you're just not quite sure about it, please don't jump on the boat. You can always ask somebody or health professional, but take it with a pinch of salt.
Let me give you an example. I think there was a WhatsApp message that said to cure diabetes, you need to boil sugarcane and honey with lemon.
Oh my gosh.
And I was like, diabetes, sugarcane. Wow.
Boil sugarcane and then add honey.
Yeah, I was like, this is a killer. Many people back in primitive areas, they have been doing such things and be killing themselves. So we need to be very, very careful. I really agree with what you said.
Yeah. And just ask questions. You know, if you think something, you're interested in a potential alternative therapy, ask questions or do your research. Just don't take somebody's word for it necessarily.
Thank you so much, Dr. Dami. Is there any last word you want to tell our people about headaches?
Well, my general last word is what I say about any health topic is that we should all be proactive about our own health. You know, don't rely on necessarily everybody else around you to sort your health out for you. If you're worried about something, see a doctor, you know, at the earliest opportunity. Better to be safe than sorry, but be proactive by taking care of your day-to-day health. So eat well, exercise regularly, try and sleep, you know, have a good sleep routine, and just have a low threshold for asking for help if you need it.
Thank you so much, Dr. Dami. God bless you. And I pray for all our listeners that you will not suffer a headache.
Amen.
Headache that will cause you more damage in your life in Jesus' name. Because we can't say you will not have headache. If you overwork yourself and you need to rest, your body might command the rest in one way or the other by
if your husband is annoying you or your wife is annoying you, sometimes it causes a headache. It's, you know, it happens.
So you just have to look for a way to get rid of it. But that does not mean that it's the devil's work. You just need to adjust to it and address it. Well, there are some things that happen that you never pray for, like the nerve in the brain bursting or vein or something like that. That's more serious, and we pray that nobody will have such an experience in the mighty name of Jesus.
Amen.
And whoever that has faced it, God will heal you.
Amen.
In the mighty name of Jesus. Thank you so much for taking out time to leave those guys at home to come and do this one. God bless you. I think you've not been here since you had...
It's been a while. I've been on maternity leave from Let's Be Real. So.
Thank you so much. We're going to have more Earth Hours. Please don't forget that you can email us any topic that you want us to bring on here. And if you have missed any of the Earth Hour episode or Let's Be Real episode, go on SoundCloud and download them. Search for stress, menopause, stroke, whatever type of sickness that you think we should discuss. And if you can find them there, please email it to us. We'll bring it on here. Thank you so much. Thank you everyone for listening. May God heal whoever is going through pain right now. Amen. In the mighty name of Jesus. God bless you all. Stay safe.
Meet Pastor Jummy Opedare, a devout woman of God, wife, mother, and entrepreneur. A God-fearing woman who has devoted her time to ensuring that God's message is used to empower everyone, but most especially women. With a strong belief in the importance of women empowering women and educating each other through our life experiences, she is the founder of Women's Forum, Let's Be Real, a forum for women to work through issues and set and accomplish goals together. Held every second Friday of every month at 6 Elton Road, Lee Green, London. Keep up with Let's Be Real here on PRZ FM every Tuesday, 8 p.m. to 9 p.m.